She wasn't at the surgery center.
Yeah. Don't overdo. Okay, have we already done 5 minutes? You've done enough today.
Just wondering how I'm going to get this off of you.
Have you ever had surgery?
Knock on wood.
We used to 45.
Does that hurt?
A little bit.
I'm going to go ahead and figure
Yeah,
out
we-
what we have. Yes.
Yeah, we-
Something really quick measurements of you. Good job. You don't want to take some right now. Your eyebrows.
Definitely hurts.
Just do your thing. I'm okay.
I'm going to glove up. I want you to relax. Actually, you can put a towel underneath your ear. Guess you wanted it bent.
Yeah. I could finally bend my finger after 6 months.
Are you going to take the stitches out, or are you going to see him and...
I seen him a week from yesterday.
Okay, so he'll probably be taking the stitches out then. So what we're going to do today is we're going to put a small dressing on it.
How's it look?
Looks beautiful.
Looks real nice, Peter.
Looks great.
What kind of stitches? Like 2?
Here's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, about maybe a dozen or so.
Oh, really? Is that one of the things?
It goes from the metacarpal joint, MCP, just past the proximal interphalangeal joint. Is this being recorded as voice too?
Yes.
Very
Do I have a new scar?
You are going to have a new scar.
Okay.
Do you want to take a look at it?
No.
Okay. I'm going to move it.
Okay, that's what we're here for.
It's gonna hurt.
Oh, yes it does.
I'm going to go slow.
Okay, I'm fine. I don't need to get...
I'm going to have you take your wrist and extend your flexion a little bit. We're going to move your wrist, yeah, that way. Good. Relax right there. Good. We're going to take all your fingers up. I want you to straighten all your fingers.
Do that.
Excellent. Now, you're used to this position. This is straight right now, okay? I'm going to bend your fingers. I'm going to bend your index finger. I want you to curl your other fingers along with me. Yes, yes. Did he say any surgery about how I got full flexion, or?
No. I wasn't put out, I was put out but not completely.
You were twilighted?
I was twilighted.
But did he say anything to you afterwards, that how much he achieved? We're going to straighten him up again.
And he showed me, I don't think it was in my dreams, but I think he showed me that the finger was bending before he wrapped me up.
It's bending. Okay, let's curl him again. Curl the tips in. That's one thing that you may have forgotten how to do. Keep curling. All the way into that fist. Not with your thumb. Keep your thumb up, okay? And then straight. I don't want to be too aggressive. You can see that we don't want the skin to come apart in the incision line. Okay, now we're just going to keep this joint, the metacarpal, you know the MP joint?
Yeah, the knuckle.
The big knuckle where my thumb is down here,
Yeah.
keep that straight, and let's curl the tips. You know that hook position?
Yeah.
Yeah, that's what we want. And then straight. And then hook the tips again, way up here. Good, good. Sorry, I'm sorry,
That's okay,
I'm sorry.
that's okay, that's okay. Down here. Ouch, ouch. Really?
So there's no Benadryl or any of that?
Benadryl or?
Benadryl, yeah,
You're meaning like bacitracin or something?
the same, you know, the orange stuff?
Oh, the
There's
betadine.
The Betadine, right, Betadine.
Yeah, I don't see any there's different products out there they
Yeah.
use. Yeah. I don't see any Betadine.
They must have washed it off,
Mm.
so they put it on before I went in. Yummy.
Okay, well, right now, we're not able to achieve full flexion yet, okay?
Okay,
Most of that's due to pain, some of that's due to swelling.
okay.
I'm hoping,
Ooh.
you're welcome.
Okay. Okay. Bill, you ready?
Do your thing and I'll do mine.
Okay, just follow my lead as I'm
Well, the place we're staying here has natural hot springs right on the premises,
Ooh.
so, you know.
So if you want to get really aggressive and make her scream, I'll turn off the camera.
No, I'll let you do that at home when you're doing this with her. I'm going to try to have the minimal amount of dressing possible so she can still move it. But I'm going to give you supplies in case it bleeds through,
Yeah,
you know, so that you're going to have to change it. Because,
yeah, I think that's what we should be recording instead of this.
Yeah, it's,
I'm gonna record
you know,
everything.
the Jeep rides are really, they put up some seats in the back of the pickup truck, but yeah, she's 78 years old, she climbs
You're
up
gonna have to see what John is doing. You can do it, help me do it. So does it look really bad?
it looks like you had surgery.
Can I look?
No, I don't think you ought to, Tina, because we don't want you blacking out again. I can tell you, I think it looks better than when it did the first time.
So I was pretty much to that part of the driver.
Well, the first one was pretty ugly.
And driving out there, my mother did.
You've got a nice long incision down your finger, and I just worry about, you see the little gapping that's going on right here?
Yeah, uh-huh.
Okay, now he does have sutures holding it together, so hopefully, but that's, because there is that little gapping in the skin there, there's a potential for more scar tissue to grow superficially there. We're going to also do individual finger. I'm going to give you some gloves, okay? But we're going to do just the tip joint by itself. Now, Christina, I'm going to block right at this. I want you to move the tip by itself. Yes. Do 10 of them. It's moving. CC, it's moving.
So, would you guys like to do adding to just get it out?
Okay, now we're going to do 10 of the middle joint. Just bend the middle joint by itself. And notice I'm blocking, I'm staying away from the incision line.
She's used to some level of that anyway, but,
I want you to try to push into it a little bit, okay? I don't want you to cause yourself extreme pain, but there's going to be more than a little bit of discomfort, if that's a nice way to say it.
if you'd asked me to predict, it was my brother who's going to drive me right up the wall.
That's what I thought.
And my mom and I would get along.
If we don't keep this tendon moving, it's going to glue to the other soft tissue around it, okay?
How many times a day? Twice?
No, more like 6 or 8. I was going to use some of this gauze to soak up some of the goo, blood, the exudate. But the more gauze I put on it, the less. Pick up your hand. Thank you. The less freedom of motion you're going to have. Is that too tight?
My mom's not leaving every day without taking a nap.
Well, that's what I ended up doing, I think,
The doctor gave me 40 pain pills. It's like, oh, I can't even take them. I took them last night. Got up like every 5 hours and ate something and took a pill. And it makes me not do very good. I'm just taking Tylenol.
It's down here, it's when it's secure. You don't necessarily have to go all the way down here. But that's not around the fingers.
Just walking around.